Iowa could establish a new requirement to teach mental health awareness and suicide prevention. State lawmakers started debating a bill last month to make it part of health classes in public and private high schools. It would require students to learn coping skills as well. An amended version in the Senate this week added 7th and 8th grade students to that. Local 4 Sean Logging joins us in the studio with what it means to a local family affected by suicide. Sean?
Jim, when Christine Schmidt lost her teenage daughter Morgan to suicide, she tells me it was important to speak out and bring awareness to this issue. She says part of that is so teens and families can relate. But as lawmakers look at this new requirement, Schmidt tells me it's an important one to get this message out to many more students and teachers.
Our teachers, our schools, they really are on the front lines of trying to help take care of our children.
The story of Morgan Schmidt is one her mother, Christine, has been sharing for nearly 5 years to help others.
Educate the public, educate children and parents on the warning signs of suicide, depression, anxiety, things like that.
Morgan was 12 years old and a 7th grade student when she took her own life. For her mom, Christine says it's a hopeful sign lawmakers are looking to make mental health and suicide prevention education part of the curriculum.
I didn't know about it until I had to, unfortunately. So I think if we can really normalize this, talk about it, educate.
At Vera Fringe, Clinical Director Chris McCormick-Priest says addressing stigma is the critical first step, and this classroom learning can be key to not just notice the symptoms and impacts, but let kids know there are resources.
We really want them to see that there's a pathway into treatment that can be very helpful, and that pathway often begins right in school.
She says when it comes to mental illness, the sooner the better.
It allows them to see those things earlier, both in themselves and in their friends.
Part of the clinical director's hope is students can then also address a big need providers face.
Into the professions that are available to treat individuals who have mental illness or psychiatric disorder.
And for Christine, moving the bill forward.
That will give so many other people hope.
McCormick-Priest also tells me there are already a number of evidence-based resources schools can use to base this education on. That includes mental health first aid for youth. Illinois representatives are also considering a bill with similar requirements. In the studio, Sean Logging, Local 4 News.